Hello, in this video I'll be talking about and performing the MiniBEST test. The MiniBEST test is a shortened version of the Balance Evaluation System test, aka the BEST test. This test helps clinicians to identify balance and posture control deficits and also to isolate which system the deficit is coming from, such as somatosensory, visual, or vestibular. It includes 14 items that address anticipatory balance, reactive postural balance, sensory orientation, and dynamic gait. The test is best used for individuals with vestibular disorders, patients recovering from CVA, and it is highly recommended for patients with Parkinson's disease. The MiniBEST is also a predictor of falls in older adults. Using the MiniBEST may be important for clinicians who want to identify malbalance and mobility problems early in the disease process as to potentially prevent mobility problems. This test may be used over the Berg balance test because the Berg primarily evaluates anticipatory and sensory contributions to balance, while the MiniBEST tests those systems as well as dynamic gait and reactive postural control. So for interpretation, there are 14 items total on the MiniBEST. They are scored from 0 to 2, 0 being that the patient can't do it at all, 2 being normal. There are 28 or 32 points in total, depending on whether you count the items with both the right and left components. A score of less than or equal to 20 indicated a fall risk in community dwelling older adults and patients with Parkinson's disease. Scores less than or equal to 19 out of 32 indicated recurrent fallers, and scores less than or equal to 16 out of 32 demonstrated adequate ability to predict falls in the next 6 months in patients with Parkinson's disease. Hello, my name is Mardisha. I'll be your student physical therapist today. So are you ready to get started?
Yep.
All right, so the first task I'm going to have you do is called a sit to stand. Basically, you're just going to sit in the chair. You're going to rise from the chair. You're going to first cross your arms. We only want you to use your arms if necessary to get up. I don't want you to lean against the chair with your legs. So you're just going to cross your arms and go into a stand. All right, you ready to get started?
Yes.
All right, you can go ahead. Good job. Let's sit back down. Okay, so for this next task, it's called a rise to toes. We're just going to be, we're going to have you place your hands on your hip. And then I want you to rise up on your toes as high as you can for 3 seconds and come back down. If you feel like you need to grab onto the chair, that's fine. So we can go ahead and get started.
All right. Ready?
All right, go. 1, 2, 3. Good. Back down. So for our next task, I'm going to have you standing on one leg. So we'll start with the left. I'm going to have you with your feet shoulder width apart. Put your hands on your hips. Look forward. And I'm going to have you standing with your right leg behind you. Try not to let your right leg lean up against your left. And so hold that for as long as you can. We're going to shoot for 20 seconds. You ready?
Yes.
All right. You can go ahead and start, and then I'll start the timer.
Okay.
Now we're going to do the right leg, same thing. You can go ahead. Okay, so for this next test, it's called a stepping strategy. And basically, we're just going to see how well you can recover when leaning outside your limits of stability. So first, what I'm going to do is have you stand in with your feet shoulder width apart, arms by your side. And so what I'm going to do is I'm going to place my hand on your shoulders, and I'm going to have you lean as far into my hands as you can. So lean. All right. And so I'm going to quickly let you go. And what I want you to do is do whatever's necessary to avoid a fall, including taking a step. Okay. So for this next one, I'm going to have you move up some. Okay. So for this next one, same thing. Arms shoulder width apart, hands by your side. but now you're gonna be leaning backwards into my hand. So lean. Alright, okay, so for this next one, we're gonna be doing the same thing but to the side. So stand with your feet together this time. Arms still by your side. And you're gonna be leaning into my hand over here. And you do whatever is necessary to get your balance and not fall. Okay. Now same thing for the other side. Lean, lean, lean. Okay, so for this next task, I'm just gonna be seeing how well you balance when standing with your feet together, your eyes open on a firm surface of the floor. I'm gonna have you place your hands on your hips, and then I want you to look forward and try to hold this position for as long as possible. If at any time you feel dizzy or like you're gonna be off balance, you have the chair there to grab onto, the wall here for support, and I'm gonna be supporting you as well. Okay, so we're gonna try to hold that for 30 seconds. Ready to go? Yep. All right. So I'm gonna have you step up into the phone. All right, and put your feet together. And this time I'm gonna have you close your eyes. All right, and I'm gonna start the timer. I'm gonna have you stand on the incline. So go ahead and step up for me. About midway. Your toes should be towards the front. Okay. So I'm gonna have you stand shoulder width apart, arms down by your side, and I'm gonna have you close your eyes. And same thing, we're gonna try to do this for 30 seconds. Okay, so for this next task, I want you to start off walking at your normal speed. When I tell you fast, I want you to walk as fastly as you can. And when I say slow, I want you to walk as slowly as you can. Are you ready? Yep. Okay, you can get started. Fast. Slow. For this next task, you're gonna be walking at your normal speed, and I'm gonna ask you to do some head turns. So when I say right, I want you to turn your head to the right. And when I say left, I want you to turn your head to the left. While you're still walking, I want you to try to stay in a straight line and maintain good balance. Okay? Okay. All right, you ready? Yep. You can go ahead. Right. Left. Right. Left. All right, good job. So for this next task, you're gonna be walking and doing a pivot turn. So I want you to walk at your normal speed. When I say turn, I want you to turn in the opposite direction and stop as quickly as you can. And when you turn around, your feet should be close together. So I want you to try to maintain a good balance. All right, so you ready to get started? Yep. Okay, you can start walking. Turn and stop. Okay, so for this next test, I'm just gonna have you walking and stepping over this box right here. So I want you to walk at your normal speed, as you normally would. And I want you to, when you get to the box, just step over it, not around it. Okay, so you ready to get started? Yep. You can go ahead. Good job. Okay, for this next task, we're gonna be doing what's called a timed up and go. So when I say go, I want you to stand up from the chair, walk at your normal speed across the first marker on the floor, turn around and come back and sit in the chair. Okay? Yep. Okay, you can get started when you're ready. All right. Okay, so for this next task, we're gonna do the same thing, but we're gonna add a component to it. So in addition to walking and turning around and coming back and sitting in the chair, you're gonna be counting backwards from 3. But first, I'm gonna see how well you count backwards from 3. So we'll start at 86. All right, so start counting backwards from 86 by 3.
We got 86, 83, 80,
Okay,
77.
so stop there. All right, and and you can start counting again. But this time, when I say go, I want you to get up and walk to the marker, turn around, and come back and sit in the chair.
Okay.
All right, you ready?
Yep.
So you can start counting.
All right, we got 86,
Okay, you can go.
83, 80, 77, 74,